Hello, my name is Gina Attaby, and here is my video. The general functions of a healthcare system. These functions include providing access to care, including preventative services, negotiated cost and determinants of who pays them, and providing coverage for all, reducing disparities in healthcare coverage and outcomes. I chose to review Germany. So the healthcare system in Germany, the government plays an oversight role, and here are my notes on the system. In Germany, there are two main types of health insurance: statutory health insurance, SHI, and private insurance, PHI. SHI covers most people, about 86%, while around 11% have PHI, which usually offers more benefits. Everyone is required to have insurance. If you make under a certain amount, you're automatically enrolled in SHI. If you make more, you can choose between SHI or PHI, which may include extra services. Most of the cost is paid through public funds, employers, and some employee contributions. Doctors are part of groups that work with insurance funds to set up contracts. People can choose any doctor or hospital without needing a referral, but doctors can only get paid for a certain number of patients and treatments each year. The system tries to keep costs down and encourages using cheaper medications. Doctors can even be held responsible if patients go over on prescriptions. Overall, people in Germany have good access to care, life expectancy is high, and mortality is low. So studies show Germany does better than the US at preventing death, and there are some differences between people with basic insurance and those who can afford extra coverage. The second healthcare system that I reviewed is Switzerland. In Switzerland, the government role is the federal government ensures everyone receives healthcare. Cantons are more of a state level, and they oversee the care and fund programs. This country also has universal coverage, and everyone is insured, even undocumented immigrants. Premiums can change depending on your age and where you live, and while the overall cost is higher than in some countries, it's still affordable. Dental isn't covered, and glasses are only covered for certain age groups. Doctors have limits on what they can charge, and maternity and preventative care are fully covered. Most of the cost is paid by the government, with people covering the rest. One unique thing is their focus is on after-hour care, which is unique. If doctors can't justify prescriptions and procedures, they can be fined and have to pay some of the cost. Access to care is excellent, and life expectancy is the highest out of all countries. Their system is rated as one of the best. In summary, Germany and Switzerland have both have healthcare systems that work better for most people than the US. Both countries make sure everyone has coverage, no matter their income or job. They focus on prevention, fairness, and keeping costs under control. In the US, many people still struggle to afford care. They don't have insurance, and even though the country spends more on healthcare overall. Thank you. I hope you enjoyed my video, and have a good evening.